these are great surgery centers that employers and cash pay patients love to use, and even insured patients love to use. But these are precisely the threats to our giant corporate hospital systems that want to keep everybody on their plantation, where they can continue to use their secret pricing contracts with insurers, and they can continue to price gouge and engage in predatory collections practices with their patients.
Welcome, everybody, to Conversations That Matter. I'm your host, Alex Newman. We have a very special guest joining us today. Her name is Katy Talento. She's the executive director of the Alliance of Healthcare Sharing Ministries. I am a member of a healthcare sharing ministry, and I've been very, very pleased with it. It's saved us a lot of money, and it's been a real joy knowing that I don't have to pay for people to kill babies and other things that I don't approve of when I pay my monthly, and I guess it's not even insurance, but when I pay my monthly premium, and it allows me to opt out of Obamacare. So I've been a big fan of these things for a long time. Now, Katy is the executive director of this umbrella group that represents a lot of the different healthcare sharing ministries. And Katy, it's an honor to have you on the program. Thank you so much. I want to start with the debate over the abortion pills. There's been a lot of news lately, back and forth, different states, feds, about whether pharmacies should be selling these abortion pills. Talk a little bit about the issue and how healthcare sharing ministries can help Americans not have to pay for these things, even if they end up ultimately being sold at major pharmacies.
Yeah, thank you so much for having me, Alex. And it's great to hear about your positive experience with your healthcare sharing ministry. So, the really sad thing, the sad story, honestly, about the abortion pills starts in the 1990s when the Clinton administration pushed through an FDA approval for these drugs, if you can call them that, under using a bizarre expedited process that's supposed to be for special experimental drugs that are used only in emergencies. We've seen many examples of the FDA behaving this way in the past few years, but at that time, this was unprecedented process for them. So it started then. There's some litigation on that matter, even today, going on. But what we're seeing has changed in the past few months is that the Biden administration has basically said that, these pills can be marketed by your drugstore down on the corner. And it used to be, what the FDA so-called approval, even the pseudo approval, it still requires in-person visits with a healthcare provider. This is very important. These pills can lead to hemorrhaging. They can lead to serious outcomes in the patient and the mother, the first patient. And we know what happens to the second patient, the baby. So, these are dangerous chemicals and powerful chemicals. And that's why the original pseudo approval required a physician's visit. But now the Biden administration has said, no, you can get these pills down at the corner store and it's no big deal. And so you have a number of pharmacies like CVS and Rite Aid that have big chains, and even local pharmacies have come out and said, we're going to make these available to patients. Now, the controversy that's brewing, beyond that, that's controversial enough. But another controversy that's brewing is that some of these big pharmacy chains, they have many, many branches in states where abortion is now practically illegal, such as Texas or other states. Utah just passed a law about this. So it's really difficult for them to have a nationwide policy about drugs that are available at their stores when some things are legal in some states, some things are not. So Walgreens recently came out and said, you know what, we're going to comply with state laws in the states where we're operating that have a prohibition on abortion. And, we won't comply with that policy in a different state where it's legal. We'll just go by the state law. And that seems reasonable. We're going to follow the state law where we're located. But the problem is Gavin Newsom, the governor of California, recently came out and is trying to bully Walgreens into doing different things in different states. So he can't focus on his own state. That's not good enough. It's not big enough. California isn't big enough for him to focus on. He wants to tell Walgreens what they have to do in Utah and Texas. So if they don't start providing the abortion pill in Texas at all their locations, California says they're going to pull a multi-million-dollar contract, presumably for Medicaid or some other government programs that California has control over. And so, this type of bullying is insane. And I don't know if the pro-life states are going to start pulling the same kind of policy and fighting back against it. But it really puts, these companies in a pickle trying to get in the middle of the abortion debate. But really, all this would be solved if a number of government policies had not been put into place that are dangerous for women and, God knows, deadly for children.
Yeah, there's no question about it, very much including the abortion policies. I want to talk about the broader healthcare system because I think really this is just a symptom of a bigger problem. We've moved more and more toward a really a centralized model of healthcare. More and more independent doctors are being absorbed into these giant hospital systems. And in conversations with a lot of doctors, it becomes clear to me that this was actually a deliberate feature of Obamacare and the broader policy, not a bug of this. And yet there was, I know some people have referred to it as a loophole. I think others have quite properly looked at this as a religious liberty issue that, we don't want to participate in this. But talk about the centralization of the healthcare system, the delivery, even the practice. I think that really became obvious a few years ago with COVID. And then how people can kind of get out of that, or at least in some ways detach themselves from that using alternatives like healthcare sharing ministries.
Yeah, I mean that's a big topic, but one of the really insidious provisions of the Affordable Care Act was that it banned hospitals being owned by physicians. Now, that means surgery centers that are freestanding and other types of facilities that hospitals, I mean, that physicians, independent docs come together and they want to open their own facility. These facilities are universally heralded as having the highest quality. It's usually you'll see a situation where you've got a bunch of orthopedic physicians who want to do orthopedic outpatient surgeries and they want a facility to do that. Those facilities are known to have the highest quality ratings, and they tend to have price transparent, bundled prices, guaranteed prices. They guarantee their work. These are great surgery centers that employers and cash pay patients love to use, and even insured patients love to use. But these are precisely the threats to our giant corporate hospital systems that want to keep everybody on their plantation, where they can continue to use their secret pricing contracts with insurers, and they can continue to price gouge and engage in predatory collections practices with their patients. And this is going on especially among the so-called charity hospitals, nonprofit tax-exempt charity hospitals. They're not paying a dime in real estate taxes or property taxes to their municipalities where they're located. They're not paying a dime in federal taxes. We're all subsidizing them. And yet they engage in extremely uncharitable behavior. And there are some of the ones that are fighting the most and refusing to comply with the Trump and then Biden price transparency rules. So this anti-competitive behavior that was enshrined in the Affordable Care Act is really a problem. And more states are trying to take a look at how they might get around it, but it's really a big problem. You alluded to something really important, which is there is a way out. There is an escape hatch, especially for people who are people of faith. And so you're right that the Affordable Care Act, in a miracle, a Christmas miracle, when the first section of it was passed around Christmas time, it actually included a provision that says, yes, we've required the entire country to buy health insurance, but for people of faith who want to be a member of a healthcare sharing ministry, we will allow them not to have to buy health insurance too. And so it exempts members of healthcare sharing ministries from that individual mandate. And it's really important because, when that mandate rolled out and really took effect in 2013, there were, a few 100,000 members of healthcare sharing ministries. Today, there are about 1 million, maybe over 1 million members of healthcare sharing ministries, largely driven by, these increasing changes in the healthcare system, whether it's corporate consolidation or these threats against their conscience rights. I mean, nobody wants their insurance premiums to be paying for the abortions or gender surgeries on kids for other people. This is crazy. And that's what a lot of people are paying for when they pay premiums into an insurance company, especially in a state like California or Colorado, where insurance companies are required to cover those types of insane procedures. So, we're really worried about, ensuring that kind of escape hatch is preserved for Americans of faith, because there's a lot of hostility out there to religious organizations, healthcare sharing ministries included, just like those hospitals are trying to shut down the physician-owned facilities. Health insurers would love to see healthcare sharing ministries go away. So these big corporate, interests that I used to call the healthcare swamp when I worked in the Trump White House, that swamp really still needs to be drained.
Yeah, no question about it. Folks, we're going to go to break right quick. And when we get back, we're going to continue this talk with Katy. Where is the healthcare system going? What should we about it? And then a little bit deeper on healthcare sharing ministries. Stay with us, folks. We'll be right back.
All right, parents, listen up. We've all seen the countless examples of how radical leftists have been destroying American schools. It's no longer just about the terrible math and reading levels. Now, radical left teachers birthed from liberal universities are forcing gender indoctrination in kindergarten. They're teaching lessons on white guilt.
Freedom Project Academy has perfected live online learning over the course of a decade. I get a ton of great feedback about this program, a ton.
They're built on Judeo-Christian values, a classical curriculum. What does that mean? It means they're taught, your children are taught the way that the founding generations of the country. My own son Noah did Freedom Project Academy for several years when he was younger.
The more we tell our friends about these things, the more people will get on board, and I believe that we can be the catalyst to some real change.
We must save the West. Our way of life and our culture is under attack, and because of patriots like you and your project, I have optimism for the future.
Welcome back, everybody. We are still here with Katy Talento. She's the executive director of basically an umbrella group for these healthcare sharing ministries. Wonderful, wonderful group. It's called the Alliance of Healthcare Sharing Ministries, and they represent a lot of really wonderful organizations, including one that I have been a member of for many years. Just because I don't want to participate in this increasingly outrageous system. Katy, before we left, we talked a little bit about where this was all headed. In my experience, we see, the big pharmaceutical companies, the big hospital companies, and big government kind of working together. And I'm honestly, I'm really troubled by these trends. Where do you think this is all going? Should people be concerned? And is there anything that you recommend that people start doing or thinking about or talking to their policymakers about to maybe try to steer it in a better direction?
Yeah, I'm really concerned too, and you're right to be. I think that, where this is all going is precisely where a large faction of our politicians would like it to go, which is increasingly towards one giant payer for healthcare. We're one of the only countries in the world that still has a, at least partially viable private healthcare system. I spend most of my days complaining and writing and punditing about how bad and how broken that private healthcare system is. But, it's the only hope for change, right? And I do a lot of work with employers as well, trying to talk to them about their options to stay out of health insurance and instead to, to consider other options, whether it's buying direct primary care, concierge primary care for their employees and working with independent administrators instead of giant insurance carriers, to considering sharing organizations and offering a healthcare sharing ministry to their employees if it's a religious employer. So, there are options out there, but we've got to fight back. And so, one of the things that people can do is to consider as much as possible engaging in the cash economy for healthcare. It's actually easier than you think. Many of Americans have a high deductible health insurance plan. And so they're paying thousands and thousands of dollars every year before their health benefits even kick in. And so why not seek out the discounted cash prices at these healthcare providers rather than using your insurance company negotiated rate? Lots of times, if you go in and you say, hey, I'm going to be a self-pay patient, even if you have insurance, even if you have a healthcare sharing ministry, we encourage people to say, I'm a self-pay patient. What is your best discounted cash rate? Typically, and there's a good Johns Hopkins study on this, typically you can get somewhere between 30 and 40% reduction in a healthcare service if you can say you're going to be self-pay, because these healthcare providers, they really like to not have to chase a patient to bill them and to chase them down for a copay or part of their deductible. So if you'll just pay them upfront or agree to be billed directly, they like to cut out the middleman. And, that increases some efficiency and allows them to give you a better rate. So one of the ways to do that is if you need a surgery, to go to one of those physician-owned ambulatory surgery centers, the freestanding surgery center, just go and Google orthopedic surgery center. and make sure that there's no hospital logo attached to it when you get to their website. That's one way. Another way is for your family to consider concierge primary care, known as direct primary care. You may have heard, Alex, about some of the doctors that are really burnt out and are sick and tired of this broken system, and they don't want to be cogs in some corporate machine. And yet primary care practices are increasingly being eaten up by these giant corporate hospital systems, and they want to turn primary care practices into just a high price referral factory to higher cost care. So they pay these doctors for 7-minute visits, so they have to fit as many 7-minute visits in a day as they can. That's not enough time to actually practice medicine and to have a relationship with the patient and really help them manage healthcare. So they end up just writing referrals for MRIs and other expensive orthopedic surgeries and specialty care that maybe they could have managed that problem on their own if they had more time and they had the right business incentives. So what these docs are doing, and it's increasingly Christian and conservative doctors that are doing this because they're the ones that have the hardest time sleeping at night being part of this immoral system. So they're leaving corporate medicine and they're starting their own direct-to-patient primary care practices where instead of billing you by the service, what we call the fee-for-service system, they bill you monthly. They have a flat rate monthly that you pay or that your family pays, and you get unlimited care from that doctor. You can get 30-minute, hour-long visits. You can get same-day, next-day care. This is the type of innovative approach that is really starting to take hold. And even employers are starting to buy this for their employees because it has such an important return on investment in terms of better clinical outcomes and lower costs overall, especially from those downstream specialty care costs. So it's a really great option. But obviously, another fantastic option, a way to stay in the cash economy, is becoming a member of a healthcare sharing ministry. A number of them actually just, they don't use a network. They just ask their patients to go in and say, hey, tell the doctor that you're self-paid, you're uninsured, because you are uninsured. Healthcare sharing ministries are not insurance. They are faith-based communities of people who come together and agree to bear one another's burdens according to, a set of sharing guidelines that they all agree on. So these are some of the options out there, and I would encourage everyone to try to do what you can to subvert the broken system.
Yeah, I love what you're saying, and the costs in America for so-called healthcare are through the roof. I mean, there's no other country that has the kind of costs that we have on our healthcare system. But I'm so thrilled to hear that the remnants of the free market are still trying to find a way here. Katy, before we let you go, I know you represent a number of different ministries, but if somebody wanted to, they're maybe hearing about this for the first time or they're just getting interested, where are some places that they could go to learn more? What are some of the healthcare sharing ministries that people could look at to see what they might be interested in?
Yeah, so the Alliance of Healthcare Sharing Ministries, our website is the acronym for our name, ahcsm.org, ahcsm.org, and you can read about healthcare sharing and some of the states that we're working in there. Our members, our governing members, include MediShare, they include Samaritan Ministries International, One Share Health out of Texas, and Altrua Health Share, also out of Texas. So we're really excited about our members, and they really represent an alternative and a place where you're not going to be spending dollars on abortions and procedures on kids to mutilate their genitals. I mean, it's time for us to band together and do something different.
It absolutely is. And folks, like I said earlier, I saved a ton of money doing this. This is not, commercial for my particular healthcare sharing ministry. I didn't even mention it, but I'm telling you, compared to what we would have paid for these disastrous big insurance policies where we know we're going to be paying for other people's abortions and genital mutilations and things, we're saving massive amounts of money. And my family and I, we're incredibly happy with our program. Katy Talento, Executive Director of the Alliance of Healthcare Sharing Ministries, former top health advisor at the White House Domestic Policy Council. Thank you so much for joining us. Thanks for what you're doing. Please keep in touch, and hopefully we'll catch you again soon.
Thank you, Alex, and God bless your audience.
God bless you too. All righty, folks. Thanks for tuning in. Conversations That Matter here. I'm Alex Newman, your host. Until next time, God bless you all.